Well, just a short time ago, Ohio Congresswoman Shontel Brown and Cuyahoga-County Executive Chris Ronayne held a press conference addressing potential health care cuts and the effect it could have on Ohioans. And it all comes amid a government shutdown. Senior health correspondent Monica Robbins breaks it all down for us here this afternoon. Monica, what can you tell us?
Well, you know what, David, we know that one of the sticking points of the government shutdown is the battle over health care. Democrats holding out over the issue. Republicans say they won't take it up until the government reopens. Well, this comes as Medicaid cuts are set to take effect in 2026, where thousands of Ohioans may lose benefits, be held to stricter work requirements, and 6-month sign-ups with more documentation proving that they need it. Now, according to Brown and Ronayne, 35,000 Cuyahoga-Countyans could lose Medicaid coverage next year. When it comes to health insurance, however, if the Affordable Care Act premium tax cuts expire, potentially thousands more could lose health insurance or be priced out if premiums double.
If you can't pay for health care and you have diabetes, that means you won't get insulin. That means you could go into coma. That means you could die. If you can't afford cancer therapy, that means you won't go chemotherapy or the surgery you need to live, and that means a life of suffering if you live. No American should die for lack of insurance, and no American should go broke for getting sick.
My rates could go from $200 something a month out of pocket to $1,200 a month out of pocket. I'm unemployed. My spouse is retired. That's a ridiculous amount of money.
Now, open enrollment for the Affordable Care Act begins November 1st. If this is where you find your health insurance, it's a good idea to start shopping for insurance now and pricing out different plans in case there is a shift in premiums. You might also consider reaching out to an insurance broker for assistance in finding an affordable plan to fit your budget. Now, having options helps, but we may have to wait to see what Congress ultimately does when they get back to work. And pricing also depends how and when any changes they make would impact the ACA, David.
Yeah, a lot of people impacted by this, Monica. Thank you for breaking it all down for us.
Sure.